Let's take a look at the origins of Social Security. The Great Depression created widespread unemployment and business failure, leaving families financially vulnerable. To address this, the Social Security Act of 1935 provided support during unemployment, workplace injury, and retirement. Payments helped sustain the economy by allowing unemployed or injured workers to continue purchasing goods and services, which kept demand alive. The act aimed to help employees and their families cover daily needs, access medical care, and retire with financial security. The Social Security Act was amended to add survivors insurance in 1939 and disability insurance in 1965. Eligibility for old age survivor and disability insurance, OASDI, and Medicare depends on earning Social Security credits through payroll tax contribution. Workers generally need 40 credits for retirement benefits, though fewer are required for disability. Monthly benefit amounts are based on average indexed monthly earnings, known as AIME, with annual cost of living or COLAs to protect against inflation. Retirement benefits can begin at age 62, though early collection permanently reduces payments, while full retirement age has gradually increased from 65 to 67. Survivor benefits are available to widows, widowers, children, and sometimes dependent parents, though payments are usually lower than a worker's full benefit. In 2022, the average monthly survivor benefit was approximately $1,326, compared to about $1,184 for a widow alone in 2012. Disability benefits are provided to workers unable to perform prior work or adjust to new work due to a condition lasting at least 1 year or resulting in death. Disabled workers generally need 40 credits, with 20 earned in the last 10 years, though younger workers and blind individuals have more lenient requirements. Disability payments equal the worker's full primary insurance amount, while eligible family members usually receive half. The Social Security Act of 1935 and subsequent amendments established 4 public social insurance programs. The act established a safety net for Americans through programs like retirement income, unemployment insurance, and later disability and Medicare. Old age survivor and disability insurance provides retirement benefits, survivor income, and disability payments, while Medicare ensures health coverage for seniors and some disabled individuals. Most workers are covered through federal employees. Certain state and local workers and children working for parents have some exemptions. Unemployment insurance, jointly administered by states and the federal government, provides temporary support, with claims increasing sharply during recessions such as the Great Recession. To address long-term unemployment in 2008, Congress expanded emergency unemployment benefits, extending coverage up to 33 weeks in high unemployment states. Federal agencies like the Social Security Administration and Centers for Medicare and Medicaid Services oversee all of the uninsurance and Medicare standards, while the U.S. Department of Labor works with states to run unemployment insurance. States determine eligibility, benefits, and program details funded through federal and state payroll tax. The act also introduced Social Security numbers in the 1930s to track wages and benefits, which later became widely used beyond employment. Overall, the Social Security system remains the cornerstone of economic security for millions of Americans. Medicare, created in 1965, provides health insurance for nearly all Americans 65 and older. Medicare consists of five parts: Part A, hospital insurance; Part B, medical insurance; Medigap, supplemental insurance; Part C, Medicare Advantage; and Part D, prescription drug coverage. Individuals can choose between the original Medicare fee for service plan or Medicare Advantage plans, which are managed by private companies under federal rules. Eligibility requires at least 40 Social Security credits, though younger people with long term disabilities or permanent kidney failure may also qualify. Part A is a premium free for those with enough credits, while Part B requires a monthly income based premium. Part B covers doctor services, outpatient care, lab tests, preventative care, and ambulance service, generally paying 80% after a deductible. Medigap insurance, sold by private companies, helps pay for deductibles, coinsurance, and copayments not covered in Parts A and B. Medicare Advantage Part C, created in 1997 and renamed in 2004, provides alternatives such as HMOs, PPOs, and private fee for service plans. Part D was introduced in 2006 to provide prescription drug coverage through Medicare Modernization Act of 2003. Many participants also have other health insurance, such as employer or retiree plans, creating the need to determine which plan pays first. Employer and employee contributions fund OASDI and Medicare under the Federal Insurance Contributions Act, or FICA. Self employed individuals contribute under the Self Employment Contributions Act at generally double the rate. Since 1990, employers and employees each pay 7.65% of earnings, while self employed pay 15.3%, with most funding OASDI. OASDI contributions are subject to a taxable wage base, while Medicare contributions have no wage cap. All contributions are deposited into trust funds for old age and survivor disability and Medicare, which operate on a pay as you go basis. Concerns about long term solvency of these programs persist, with options including raising taxes or cutting benefits. The system is strained by longer lifespans, lower tax contributions, unemployment, and rising medical costs. The Federal State Unemployment Insurance, or UI program, provides weekly income to people who lose their jobs. Each state administers its own program within federal guidelines. To qualify, individuals must meet eligibility criteria like involuntary unemployment, minimum earnings during a base period, availability and ability to work, and active job searching. If an employee voluntarily quits, that usually disqualifies workers unless for a reasonable cause, while misconduct, refusal of suitable work, and certain labor disputes also disqualify eligibility. Most states define the base period as the first four or the last 5 calendar quarters before filing a claim and require a minimum earnings threshold. A waiting period, usually 1 week, applies in most states before benefits begin, serving both administrative and cost control purposes. Weekly benefit amounts vary by state and are generally 50 to 67% of previous earnings, calculated using one of three methods tied to wages during the base period. Standard UI benefits last up to 26 weeks, with extended benefits of 13 weeks and sometimes more during high unemployment or recession. Some industries also use supplemental unemployment benefits, or SUB, through collective bargaining, especially in cyclical sectors like steel. UI benefits are funded by employer payroll taxes under the Federal Unemployment Tax Act or FUTA and state laws like that provide taxes and tax rates influenced by employers' history of layoff. Unemployment insurance provides critical temporary support while encouraging workers to re enter the labor force.